Hello, everyone. I'm Lisa Hinton, the Executive Director for the American Heart Association in Metro Chicago. And joining me today is Dr. Celeste Thomas. Dr. Thomas, could you introduce yourself to us?
Yes, of course. So I'm Celeste Thomas. I'm an endocrinologist at the University of Chicago, and there I work in the Department of Medicine, and our focus for me is really on improving the quality of diabetes care in the inpatient setting and as well in what we call the ambulatory setting, where people are kind of going out and about their lives.
Great, thank you. Thanks for being here with us today to answer some of our burning questions. I know a lot of people will be really interested in what you have to say. So to start off, there's been a lot in the news about underlying conditions. Hypertension's an underlying conditions, others asthma, as it pertains to COVID-19. Where does diabetes fall? Is that considered an underlying health condition?
Yes, so diabetes is considered an underlying health condition. And so it's important for people who have diabetes and even those who have family members or a strong family history of diabetes to recognize that it's a potential underlying health condition and to be careful and to be safe and be prepared.
Yeah, wonderful. Thanks for sharing that. And what if, I imagine if I were living with diabetes, I'd be asking myself, what do I do if I feel ill? If I have symptoms like high fever or a cough and shortness of breath, what should I be doing right now if that were me?
So I think it's really important to be in touch with your doctor. And I know that a lot of our clinics have closed and we're moving to telemedicine, but it's important for people to know that your doctor is still available and so that your healthcare team can be reached. And if you're feeling well, that's great. We still want to talk to you to make sure that you have all the supplies you need to manage diabetes. But if you're not feeling well, then it's really important that we hear from you so that we can talk about what those symptoms are, determine if you should be tested for COVID-19, and then what we should be doing to protect you from the complications of the disease.
Sure. So if I think I have the symptoms of COVID-19, should I be reaching out to my diabetes specialist or call a primary care doctor?
For a lot of people, it may involve reaching out to both. And the reason why I mention that is because of type 1 diabetes. And so for individuals with type 1 diabetes, if they have an infection, they've got to remember what we oftentimes call sick day precautions, which means we want you to think about checking for ketones. So our patients with type 1 diabetes know what that means, which is they're looking to see if their body is making ketones. And that can happen even when the blood glucose levels are not really high. And so if you're feeling sick, it's a good time to reach out to your endocrinologist if you have one to review what you should be doing to make sure that high blood sugar and that diabetes emergencies don't contribute to you feeling worse than you otherwise would. And for a lot of people, their endocrinologist may be also able to reach out to their primary care physician to order testing or to talk about next steps regarding the viral illness. But sometimes it might make sense to reach out to both.
Thank you. That's very helpful. So we know that diabetes is an underlying health condition, and so there could potentially be complications if a diabetic is infected with COVID-19. What are some of those complications that we've already seen? And I know you mentioned type 1 diabetes. Are there differences in those complications between type 1 and type 2 diabetes?
Right. So we do think that we're concerned about the whole population of those living with diabetes, but we are seeing some increased complications in those with type 2 diabetes. And that may be because that other underlying health condition you mentioned earlier, hypertension, is part of what we sometimes call the metabolic syndrome. And we think of that as hypertension, type 2 diabetes, having a lot of abdominal excess weight or obesity. And so when we're looking at the outcomes from China and even some of our recent publications here in the United States, we're seeing those components of metabolic syndrome really contributing. Separately, there's groups that are monitoring, outcomes for all patients with diabetes and are looking very specific at the classification so that we can understand what's happening with type 1 diabetes as well.
Thank you. That's very helpful. Now, if I'm at home and I'm a diabetic, I'm probably wondering with the stay-at-home orders, how can I safely get food and medicine and any protective or other supplies that I need?
Right, and so this depends on, how do you normally get food? Is this in your age and a lot of different circumstances. So a lot of our grocery stores are allocating an hour early in the day for those who are older and those with pre-existing diseases that increase their risk. And that includes diabetes. So if you've got a grocery store in your area that is offering that time, then we should absolutely use it. In addition, the masks are important. And so for us to wear a mask and for the employees, those essential workers within the markets to wear a mask, that's important as well. And then everything that we heard from the CDC at the beginning, which was, the importance of hand washing and hand sanitizers, that continues to really be the way to protect ourselves. And I would argue, doing a lot of grocery shopping so that you're not having to go back in multiple times, but really this is the time to get back to that planning and creating that list and even thinking about how you're getting safely through the grocery store so that you can plan ahead and not have to go back too often.
That's helpful. Load up, right? I've heard that grocery store hour called the senior hour before. So it's so helpful to understand that that is really meant for people with underlying conditions as well, all of our at-risk populations. So thank you for clarifying that. I know you talked about like filling that shopping cart up to minimize the number of trips. Are there any other supplies that I should be having on hand? What does that look like?
So everything that we need in order to effectively manage diabetes. So these are the glucose monitoring supplies, making sure that we have adequate medications. And so this is where it's also important to reach out to the healthcare team, and having 90 days of your supplies would be really helpful. If there's a pharmacy that can ship that, we're much better off than having to stand in line at the pharmacy. And so thinking about all of the supplies we would need, the healthy food, the glucose monitoring supplies, the diabetes medications.
Right. And then are there any conversations that diabetics should be having with their family members during this time? What ways can family members or people that you may be living with, it could even be a roommate or something like that, what conversations should we be having and how can they help?
So this is actually something I shared with a patient yesterday. So we're doing these telemedicine calls, and my patient is doing all of this hard work to protect himself, but he lives with a 14-year-old and an 18-year-old. And I asked him about what are they doing to protect you as well. And so it's really important to have those conversations. So if you're living with people, they've got to wash their hands too, and they've got to leave the shoes at the front door as well. And then for older adults and for it's important for us to recognize that when we use that term social distancing, that we're really thinking about physical distancing, but we still need to reach out to those who we love. And so in making sure that we're not, this is an anxiety-provoking, really stressful time. And so reaching out and having those conversations with loved ones about how are you doing and how are you really doing is really important.
Yes, such important advice there for us all, absolutely. I think that's all the questions we have for you today. Anything else that you would like our audience to know?
Yes, thank you. And this is, if you're not feeling well, please call your doctor. Please call somebody on your healthcare team. I know that there is this fear for going into the emergency department and not wanting to get COVID-19 or to be exposed. So call your doctor and then discuss how you're feeling and what those next steps should be. For some people, they should be going to the emergency department, and emergency departments are prepared to protect you. And so it's really important that people not stay home when they're too sick, and that we recognize when we're getting really sick and avoid staying home until it's too late.
Absolutely. Such great advice. A great reminder that it is safe for anyone at any time to call their doctor, and for everyone who may be having a medical emergency to go to the hospital. So thank you for closing with that important reminder. Appreciate your time today, and we hope that you stay safe and healthy.
Thank you. You too.